Dean Hedges.
Hi, I'm May Okihiro. I'm here on behalf of Dean Hedges and the College of Health Sciences and Social Work. I'm also here as a pediatrician at the Waianae Coast Comprehensive Health Center and a fourth-generation Kaneohe resident. So we are definitely in strong support of this bill, and we were a voting member of the task force and honored to be part of that process, where we really look through the evidence on the best strategies on tackling this problem and chronic disease prevention. A couple stories that I wanted to just bring to you as a pediatrician. So a couple months ago, I saw a 8-year-old girl who came in for a rash, and she was 120 pounds, and she had developing acanthosis nigricans, which is the darkening of the neck and is a sign of insulin resistance. Her grandmother brought her in and said that she had been buying for the family 10 cartons of grape drink and fruit juice or fruit punch every week for the family, because that's what the kids like to drink. And she thought she was providing for the family. And she's not a dumb grandmother. Has been convinced by the media and all of our social norms that this is the right thing to do. And so it took a long talk to get her to think twice about that. The second story I wanted to tell you was about a 17-year-old that came in to see us on a Saturday several months ago. He hadn't been seen for 18 months. He had gained 60 pounds and was drinking 5 to 6 cans of soda a day, and now had bad asthma. And when we did his labs, he had was right on the border of being diabetic. He had very bad prediabetes. And so he had just gotten into the University of Hawaii and is really a bright spot in our community. But I want all of us to think of the economic impact of him and his family, and what we need to do to deal with this really complex problem. We understand that sugar-sweetened beverage fee won't be the cure-all, but it will make all of us think twice about buying sugary beverages, and I think begin a comprehensive strategy to begin to address the problem.
Thank you.
So, thank you.
Thank you, Mary. Next we have, let's see, Child and Family Service. This is from Howard Garble. Support. Malachi Grange.
Hi, thanks very much. I'm testifying as a parent and a citizen, although I also do public health work collaborating with schools. And you've heard everything about obesity leads to chronic disease, leads to really skyrocketing health costs. Two things I like to say. One is the analogy to
Give us your name, sir. I'm sorry.
One is the analogy. Sorry?
Your name. I'm sorry.
Oh, Malachi Grange.
Okay, thank you.
One is the analogy to tobacco, which Dr. Maddox brought up. It's taken decades to go from about 50% to under 20% smokers, which drastically reduced our burden of the healthcare system. And the main driver of that was taxation and laws, and it took decades. So we're addressing this similar chronic problem with taxation. There's plenty of other things we need to do, but it's a good first step. One brief story. Working with the school, I had a child whose BMI was in the 40s, morbidly obese, highly at risk for all kinds of conditions. What the parents and the school and the people who were collaborating with the family did, first intervention, stop all sweetened beverages. He drank 2 Slurpees a day and a 6-pack of Coke, And over 6 months, he went down to 35 in his BMI, drastically reducing his risk for diabetes and all kinds of things. Still had a long way to go, and there was other things for him to do. Hello? Can you hear me? Okay. Could you hear me all the time?
I could always.
Okay, great. I don't need to repeat what I say.
He's been saying a lot of bad things, I think, about soda, and good things about kids.
Yeah. The point is that by reducing the consumption of sweetened beverages, you reduce the risk of obesity, you reduce the risk of chronic disease, which helps our health costs go down. As someone said, we are heading for a cliff. More and more people are disabled. from this consequence of obesity. More and more people don't work, they don't pay taxes, health costs go up. You know, as a nation, we're going to be in trouble, so we need to take some action.
Thank you very much, Anka. Next, we have YWCA Pioneering Health Communities. Took your glasses off. She's somebody else.
This is a different hat.
She was Superwoman before, or now, I should say.
May Okihiro. I'm representing Pioneering Healthier Communities now. This is a leadership committee that consists of many different segments or sectors of our society: business, insurance plans, health communities, and former Judge Michael Broderick is our chair. And we wanted to come together to say that as a voice, as our collective powerful voice, that we really support this measure. It's very important. We think that a broad strategy needs to be implemented, but that we've got to put speed bumps in the open highway right now to chronic disease prevention, and we think this sugar-sweetened beverage bill is the first step.
Thank you, Doctor. For the record, the team, I guess, of testifiers on this piece of testimony were CEO Broderick, Jennifer Dang from DOE, Sam Iona, Joy Barua from Kaiser, who's the benefits director there, Breen Harimoto, City Council, Lola Irvin, Department of Health leader, May Okihiro, Daniel Leung from Kapiolani, Ann Young from the Office of Community Services, Robert Witt from the Hawaii Association of Independent Schools, Michael Libertini from Bank of Hawaii, Vice President, Barbara Pleadwell, Hastings and Pleadwell, Ann Peterson, and Diane Tabange from the Y, Director of Child Care. We also had testimony from Stacy Nee.
Good afternoon. Thank you for hearing our testimony today. I am the reigning Mrs. Hawaii. I'm also a mother of 2 small children, a registered dietitian with a master's in nutritional sciences from UH. I'm here in strong support of this bill. We all know the statistics, so I don't want to belabor them, but obviously in Hawaii the statistics on obesity are alarming, with 1 in 4 obese adults and 1 in 3 children entering kindergarten overweight or obese. I can testify that during my work as a registered dietitian, I have worked directly with the children who are overweight and obese and their families. And I can tell you that as a nutrition educator, it is like fighting an uphill battle. And that's largely in part to the environment, and sugar-sweetened beverages are a big part of that. The access to them, especially amongst the communities where we see the largest numbers of obesity and that of those health disparities. And let's just face it, they tend to be a little cheaper to get than things that may be a little less or a little more healthy. And I think that, this proposed fee, the fact that it's expected to reduce the consumption of sugary beverages by 8 to 10% and raise revenue, obviously, toward programs that would prevent and educate about the childhood obesity epidemic, are strongly encouraged. I also want to let you know that I am here as a advisory board member of the HICOR, which is the Hawaii Initiative on Childhood Obesity Research and Education, and the 5210 program. And that O in the 5210 program is, aiming for 0 sugar-sweetened beverages in a child's daily intake. Thank you so much.
Thank you. Other late testifiers who did receive an incredible amount of testimony in this measure. Dr. Brady? We'll get everybody, for sure. And we apologize. We have another bill that generated a little bit of attention from the that nicotine device, the smoke-free e-cigarettes, so about this much. So some testimony may have been shuffled a little bit today. Dr. Brady?
Honorable Chairs He and Green and other honorable members of the committee, I'm Kalani Brady. I'm in this position, I'm a member of the board of directors of the American Heart Association. I'm a primary care doctor in a clinic which is about 60% Native Hawaiian, and I'm an associate professor at the University of Hawaii, John A. Burns School of Medicine. Speaking primarily for the American Heart Association. In my own clinic, obesity obviously is a major concern, and on a doctor by doctor by doctor dealing with patient basis, we can make some difference. However, it is known that public health decisions like this make a far more important course of change than sometimes the doctor-patient relationship. And I know others, probably smarter than I am, have named all these, referred to statistics that we all know so well, but I would like to make a matter of record a few of these statistics. Since the late 1970s, sugar-sweetened beverage use among adults has more than doubled. Each additional 12-ounce soft drink consumed per day by children increases their odds of becoming obese by 60%. Soda consumption nearly doubles the risk of dental caries in children, a problem that is, as you know, a major health problem in Hawaii. And $470 million a year are spent in the state of Hawaii on obesity and obesity-related disease. So I am definitely personally in support of this fee, and my organization that I represent, the American Heart Association, is strongly in support of this bill. Thank you.
Thank you, Dr. Brady. Sorry.
I apologize. Kathy Manman from the Department of Human Services. We'll stand on our written testimony and strong support.
Thank you, Director. If I don't have your name from before, we're going to just come people right around this way and make sure you give us your name for testimony. Okay.
Senator Green, Senator Heene, members of the committee. Gary Sullivan delivering testimony from David Thorpe of the American Beverage Association. And if you didn't,
I'm not sure they can hear you, Gary.
I'm delivering testimony from David Thorpe of the American Beverage Association, who we're representing. And if you didn't get the testimony, I'll deliver it to the staff so we get it. And it's extensive. I just wanted to make a couple of points. The statistics show, in fact, that the characteristic of the beverages that people are drinking has changed very dramatically over the last decade, certainly from the time I was a kid when there were no such thing as diet drinks and so on. So the consumption of sweetened beverages has actually dropped consistently, and they've been replaced by many other things, many other kinds of beverages, including water, and other beverages that don't have sugar in them. At the same time, obesity has increased. And the amount of, according to the Cancer Institute statistics, we have about 93% of the sweets people get are from things other than the things they drink. So the point of that is that obesity is increasing. It's clearly an issue. As we point out in our testimony, this industry has actually voluntarily done a great deal to address the issue, voluntarily taking drinks, sugar drinks out of schools. We're supportive of another bill that has been introduced by you that would deal with that issue. We're in support of that. We've done a lot of other things to try to address the issue more comprehensively. I think we take exception with the notion that you have to start someplace. I think the problem with that is if you're going to start someplace, then you really ought to need to think about starting at a place that's really going to make the most difference. When I was a kid, all we drank were these sweetened beverages. What was the difference? Well, obviously, we know that exercise was a lot different. You didn't have all the internet games. Should there be an internet tax? I guess what we're saying is that the tax on beverages is, first of all, it's very regressive, and it focuses on one very small aspect, an industry that's already doing a lot, and I think that it's not a start, because the problem then is that if you start here, the natural inclination is, okay, we've taken care of obesity, let's move on to other things. The causes of obesity, experience over many years tells us this isn't what it's coming from. Are there people that drink too much? Of course. Are there people that drink too much macaroni salad? Absolutely. Where's most of it coming from? Most of it, we think, is coming from other places, and so we feel a comprehensive approach is better, and we think that a tax on these beverages actually undermines the ability to really take the comprehensive approach. So we thank you for the opportunity to present our views. Thank you.
You bet. Let's go right over here. Right, first you. I'm sorry, come on. Yeah, you can see you.
Terry Locke, Director of the Executive Office on Early Learning. Thank you for the opportunity to testify. I just want to mention that I had the privilege of being on the Obesity Task Force, and the task force has really taken a comprehensive look at this complex problem. In relation to children, I just want to say that over the past 30 years in the United States, children and adolescents have dramatically increased their consumption of sugar-sweetened beverages, including soda, fruit drinks, and punches, and sports drinks. Such consumption is linked to less healthy diets and a number of other negative consequences. So I just want to mention some of the things that you might already see in your research. Decreased bone density, dental decay, headaches, anxiety, loss of sleep. We're finding that it reduces the intake of important nutrients by replacing milk consumption and is associated with lower bone mineral density and an increased risk of bone fractures among girls. So I just want to say it's really trying to change the habits of the way we're consuming our products and food. Thank you.
Thank you, Terry. Robert Hirakawa. We may not. Most likely late. Yeah. And
Senators?
I apologize. Anyone who does come up, if you could submit testimony. I'm not singling you out, Robert, if it hasn't gone in yet. But we can get it later today.
Okay, thank you.
You bet.
Senators, thank you for the opportunity to testify. My name is Robert Hirakawa. I'm the CEO of the Hawaii Primary Care Association, and this is Dr. Villasego, who is a pediatrician at the Hawaiian Coast Comprehensive Health Center, and she is also the chair of our External Affairs Committee. Now, the Hawaii Primary Care Association, which represents community health centers in Hawaii, supports SB 1085 relating to obesity prevention, which establishes a tax on sugar-sweetened beverages. There is little doubt that a health crisis exists in Hawaii, aided in no small part by the consumption of sugar-sweetened beverages. Sugar-sweetened beverages contribute to a significant portion of the calories consumed by the average American, while at the same time providing little to no nutritional value. The HPCA supports a tax of 1 cent per ounce of sugar-sweetened beverage, along with the proceeds from such a tax being used to establish an obesity prevention special fund. Obesity is a problem that must be approached proactively, and the establishment and support of programs targeting diabetes, cardiovascular disease, physical fitness, nutrition, and other related topics will do just that. So we urge you to pass Senate Bill 1085.
Aloha. Senators Green, Shimabukuro, and Chun Oakland. As stated, I am not only representing the Hawaii Primary Care Association here, but I'm also a practicing pediatrician at the Hawaiian Coast Comprehensive Health Center, where I have worked for the past 20 years. This is going to be the first generation where our children do not survive their parents. That is a fact. We are already seeing children at the age of 12, 13, 14 developing diabetes. I saw an 8-year-old the other day. May saw a patient that was how much did your patient weigh? Mine weighed 180 pounds. An 8-year-old that weighed 180 pounds. Wow. It's I could speak for hours about this topic, so I won't belabor the fact. You've heard a lot of excellent statistics already, but I really, really urge you to pass this bill. It is the first step to take. It is not going to solve the problem completely, but it is certainly going to really help. So please, I urge you very strongly to take this into strong consideration. If you have any further questions, please feel free to contact me at any time.
Thank you. Thank you. This gentleman in the back. Next.
My name is Roger, and I drink sugary beverages. I'm Roger Maury. I'm here on behalf of the Hawaii Restaurant Association, representing about 1,000 restaurants statewide. I have previously submitted written testimony, and there are a couple of more points I would like to add. One, the bill, as written, is, if not usurious, is certainly unconscionable. It would take a common, everyday consumer product that can be purchased on sale for $8 and raise the price to nearly $10.50. That would be an increase of about 25%, making it usurious, if not unconscionable. Secondly, and as importantly, if this bill were to become law, you would be sending the wrong message to people who are obese. You would be saying loudly and clearly stop drinking sugary drinks, and you're safe. You ain't going to be safe. If you want to fight obesity, it shouldn't start at the grocery store or the restaurant. It should start at home with the parents, and the schools educate their children on proper diet, proper exercise, and only if you start treating the cause, not the effect, will you become successful in fighting obesity in Hawaii, which according to the Center for Disease Control is not a problem, I think, for like 48 out of 50 states. Nonetheless, we strongly oppose the bill, and we strongly urge you not to support it.
Thank you, sir. You bet.
Good morning, Senators. Thank you for the opportunity. My name is Leslie Lamb. I'm a member of the Obesity Task Force, also the director of the American Diabetes Association. And I speak to you on behalf of our many parents who call us with the diagnosis that Dr. Okihiro was saying. We see such a correlation between children diagnosed with obesity and diabetes in our state. So on behalf of the 113,000 people here who have diabetes, we ask you to please support this measure. We have statistics that we've gone over before that 1 out of 2, if trends continue, 1 out of 2 keiki will develop type 2 diabetes by the age of 30. We have parents calling us and saying, how do we stop that? Well, we see this as a direct start for us to initiate awareness and education, and we ask you for your support. Thank you.
Thank you, Leslie. And Dr. Gill?
Senator Green, Senator He, Senator Chun Oakland, Senator Shimabukuro, thank you very much, and thank you all. This might sound a little like something you've heard already before. I'm here with 3 of my classmates today, and we're here with a few public health students and law students as well. We're generally not involved in the political process. It's not what we do. We're worried about studying for the exams. I actually got permission to skip one today and be here. So it's my privilege to actually speak on behalf of the Association of JABSA Medical Students. So I'm not the university. I'm not JABSA. We're the students, and we care about this issue. We strongly support this bill because these are going to be our patients one day. There's a very, very clear association between sugar-sweetened beverages and obesity. This is not something we can deny. And I think I, like everyone else in this room, knows that the tax, the fee, whatever you call it, isn't going to solve the problem. But we don't have an obesity fund right now. This is going to make one, and this is going to allow the opportunity for a multifaceted approach to address a multifaceted problem. This is it's a clear issue to us. We won't be able to treat diabetes, but we can prevent it now with proper legislation, and that's why, as the Association of JABSA Medical Students, it's my privilege to strongly support this bill. Thank you.
Thank you, Tom.
Good afternoon, Wes Lehman, of the Department of Public Safety, Healthcare Administrator. The department stands on its written testimony in support of the bill.
Sheila Beckham, CEO, Waikiki Health Center. Much of what I was going to say has been said, so I won't belabor the points, but I wanted to share an experience. 25 years of my career as a registered dietitian with graduate degrees has been spent working at Waianae Coast Comprehensive Health Center, developing, administering obesity-related programs, research, clinics, multidisciplinary teams, and direct patient medical nutrition therapy intervention. What I have found in that 25 years of experience is that the easiest way, the most successful way that I was able to help children and adults lose weight was through limiting high-calorie, empty-calorie sodas, sweetened juices, and those kinds of things. They still had an opportunity to, not that that's a cure-all, but they had an opportunity to feel well satiated eating the regular food, and yet they just substituted something that had no calories, or like vegetable juices or 100% fruit juices, instead of these high-calorie drinks. Many people are able to lose 1 to 2 pounds just by changing the beverages that they drink. So I strongly support this measure on behalf of Waikiki Health Center. Thanks.
Thank you, Sheila. Dr. Pressler?
Good afternoon, Senator Green, Senator John Oakland, Senator He, and Senator Shimabukuro. My name is Jenny Pressler. I'm Executive Vice President at Hawaii Pacific Health, which is Kapi'olani, Palimomi, Straub, and Wilcox hospitals. I'm not going to repeat the things that have already been said, but I also was the Vice Chair of the Obesity Task Force, and I think it is very important to emphasize this bill does not stand alone for some of the reasons you've heard today, but it is a very important part of a comprehensive approach to dealing with the obesity crisis and epidemic in our state. Even though we have better statistics than nationally, our trend is the same as nationally, and we've had a doubling of the obesity problem in the last 10 years, with 1 out of 3 of our children either being overweight or obese. So having Kapi'olani as part of our system, we see tragic cases every single day, as you've already heard attested to. I just want to emphasize this is not a slam on the beverage industry. I highly applaud their movement over the last few years to provide more opportunities for beverages that are not sugar sweetened, high caloric consumption. I drink unsweetened tea and other things like that, and we all drink bottled water. So there's lots of other opportunities besides sugar-sweetened beverages, which are killing our kids. Thank you.
Thank you very much, Dr. Pressler.
Sorry. Good afternoon.
Hi.
My name is Jeff Matheson. I work for Ball Corporation. We're the only can manufacturer on the island. We started operations in 1979. We employ 34 union workers and represented by the ILW and 11 staff members. We're the only company that makes cans in Hawaii. Without a local company like Ball Corporation, all cans would have to be shipped here from the mainland. In addition to raising consumer prices more precipitously, it would be a blow to the local economy that relies on us. Consumers already pay 3 taxes on a beverage: the deposit, the handling fee, general excise tax. Additional taxes that single out one set of products is unfair. It's unfair to us. Our company operates on an incredibly thin margin. If new beverage tax affects us as much as the deposit fee did, we're surely going to have to shut down the operations and lay off all 45 workers. I've been at the plant since 1989. We used to run 7 days a week, 24 hours a day. We had 120 employees. Through the change of consumers' habits, different packaging options, and efficiencies, we were forced to lay off a crew, and the operations changed to a 5-day work week. When the deposit bill came into effect, we lost about 8.3% of our business. Again, we had to lay off another crew. You know, we struggled through the tough economic times. You know, there's lots of stuff has happened, but we've still maintained the viability of the plant. I think one of the goals of this bill is that the consumption of sodas be reduced by 18%. If we lose 18% of our volume, surely we're going to shut down. You know, I don't want to be the one that has to tell 45 employees that we're going to lose our jobs. Thank you for your time.
This one.
Yeah, that's
okay. Thank you again for you guys' time. Like my boss here, I represent Ball Corporation. When I first found out we had the opportunity to testify today, I thought was just representing the 45 people that I work at. But after researching and doing my homework on the internet and whatever, I found that from just our plant manufacturing cans here on Oahu, we generate an additional 315 jobs in supply and support industries for a total economic impact of 360 jobs and $46.41 million in economic activity. These are all good paying jobs for people that average about $56,000 a year. What I did not account for was another 1,200 jobs. In an article from the Maui News and Honolulu Star Bulletin, that's what they're saying, that workers in restaurants, supermarkets, convenience stores, and other businesses that also depend on beverage sales for that. Don't get me wrong. I know that child obesity is a problem. I have children, I have grandchildren, but I don't think this is the way that we want to go about it. I believe that it's consumer lifestyle education that will encourage people to make healthy choices, not punitive legislation that will put 1,500 people out of work. I mean, we look at what's happened to Tesoro, Aloha Airlines, Pearl Harbor. I mean, all these people looking for jobs. With manufacturing in Hawaii very scarce, I mean, the people that are in our industry, we have no place to turn. God forbid we're going to be on unemployment or worse, welfare. We're all good people. We all, help our communities. Part of our church make the world a better place, with our time off. Help the schools, help Little League, help kids, Girl Scouts, Boy Scouts, and we continue to do that. But without a good job, shucks, we'll be working 2-3 jobs to make that kind of for our family. We don't want to have time to contribute to our community. I know in my life I had to make a lot of hard decisions, and I realized that the bad decisions that I did make was because I didn't have all the facts at hand, or I never looked at the other side of the fence. I just hope and pray today that you guys, take all the facts into consideration and do the right thing. Thank you so much for your time.
Thank you for coming. Take 1 or 2 more testifiers, then we'll have about 15 minutes of questions. Yes, please. You can just turn it to yourself wherever you like.
Hi, my name is Dr. Christina Ancog. I'm a practicing pediatrician out in Nanakuli in the Kaiser Clinic there. I've been in practice for 24 years. In the past 24 years, I've seen a ballooning in my population. The children are just more and more obese, and the standard is obese, not healthy weight. I've seen some individual patients who have lost weight by making changes, exercising more, cutting their diet, and especially if they can just cut out the sugary drinks, they really do lose weight. The important thing is that I can only do that as an individual. We need to make a difference in our population, and using this fee to make it cheaper to make healthier choices is what we need to do for our children to keep them from killing themselves. Thank you. I strongly urge you to support this bill.
Thank you, Dr. Ancog. Gentlemen? Thank you. I've missed you.
Good afternoon, Senator Green. My name is Bill Comerford. I speak for the Hawaii Bar Owners Association, and I stand opposed to this bill as do many of the members of our organization. We recognize that there is problems with health issues, but we recognize there's other tax bases out there. The composite problem is what really comes down is in the long run, how much do you want to pay for a soda? How much do you want to pay for a beer? How much do you want to pay for a cheeseburger? All those things I serve in my bars, but I see directly through the cost of not just your one request for a tax, but the series of taxes that we have to deal with. Also with liquor taxes, minimum wage increases, increased benefits to all the employees. All these compound issues take from the bottom line and force us to raise the price of the cost of the item we're going to sell. In the long run, what that means is, will you go out and have a $6 soda? Will you go out and drink a $12 beer? Will you only eat an $18 cheeseburger? All those things become a factor because in the long run, we have to raise the prices. And if we raise the prices beyond what the customer will bear, you lose the business. And if you lose the business, you lose the tax basis. As a result, who do you tax then? So, unfortunately, I know right now we have a tax on the, looking at the tax on the soda. We do have a tax on the alcohol. I expect someday we may have a tax on a cheeseburger, but I certainly hope not. Thank you for your time.
Thank you, Bill. All right, members, why don't we have questions? I'd like to have the Director of Health up for a second, if I could. Thank you all for your patience. Director, a quick question about the Obesity Prevention Special Fund. What do you have envisioned for that fund?
This would be a comprehensive fund that we would look at, as said earlier, to look at a more comprehensive approach. So we'd be looking at funding programs for obesity prevention, diabetes prevention, looking at programs at a community level, at a school level, as well as individual education. So we'd be looking at how can we support healthier choices at school, at home, at work. We'll also be looking at how you could make your environment healthier, make it more walkable, more bikeable, so that we could encourage people to have more physical activity. So it would look at it more from a comprehensive perspective.
How much money does the fee bring in if it passes?
If it passes, we expect that it would bring in $37 million a year.
Okay. Members, questions for the director? Okay, thank you, Director. Yeah, wait, Director?
May I ask you a question, please?
Yes.
You rattled off a lot of safety net programs.
Mm-hmm.
Can you did you provide a hypothetical budget for $37 million?
We have one.
You have one?
That we can provide to you, yes. And it, again, would look at interventions that would be involved at the school level. At the community level, more than likely we would put out an RFP. We'd be working with our healthcare providers, community health centers, and other private providers in the community. We'd be looking at programs like breastfeeding promotion, because that's one of the best things you can do to start early, to get healthy nutrients in you, and other activities. So we put together a budget for the $37 million.
Can you provide that before we go into decision making?
Sure.
Okay. Thank you.
Thank you, Director. Members, other questions for those who have testified?
Yes. Thank you, Mr. Chair. Mr. Comerford?
Is he still here?
Oh, I'm sorry. Okay. All right. Thank you, Mr. Chair. Yeah.
Okay. Members, other questions? Chair?
Thank you. This is a question more for the physicians or the healthcare professionals that may be able to provide insight. For the patients that you have served and the children that you have served who are obese or morbidly obese, did you actually ask them what would actually help them in their choices, or would this particular measure actually have any effect on their health directly?
May come up.
I think many of us often directly ask the parents and the child, if they're old enough, what choice they would like to make themselves healthier and to begin to bring about lifestyle changes. So what comes up often is accessing more fruits and vegetables and healthier foods. The expense often comes up. And so can we provide coupons for farmers markets? Can we provide more farmers markets or more innovative programs to bring healthy foods to the communities? The second thing is physical activity. How can my child access physical activity? I work 2 jobs. I've got 4 other kids. I don't have transportation. So can a comprehensive program bring physical education and physical activity to schools and after-school programs? And is there a way we can do that as individual children, for the individual children and for the families to be engaged also? So we think that this bill could provide that by providing funding for those comprehensive programs. I think the other thing is that they often will say soda, it's so cheap, so we just buy it because that's what the families like. So to make them think twice, this bill would help families think twice about it and possibly then choose other drinks like water and milk.
Mm-hmm. Okay. Anyone else have thoughts? Thank you.
Thank you. In addition to everything that Dr. Okihiro said, I would also say that education can really be improved. As Dr. Okihiro indicated earlier, there's a lot of marketing here that appeals to our patients, our families, that is really misinformation. We have patients who come to my office drinking a bottle full of orange liquid, and it will be orange soda. And the assumption is because it's orange, it has fruit in it, it must be healthy. the same goes for vitamin waters and all the sports drinks. They assume that it's healthy because it's marketed as such. It's marketed on television, on radio with wonderful, handsome sports stars who are healthy and buff. And so I think that, you know, everything that Dr. Okihiro said is extremely important, but educating our population, and again, as Dr. Ankog said, I'm just one pediatrician. I can't do it all alone. We need something more aggressive, more assertive, more widespread.
Thank you. The other part for the pediatricians and other healthcare professionals is with regards to the bill, it actually bifurcates the type of drinks that people will be or are currently drinking. Sweetened beverages with either corn syrup or regular sugar would be taxed under this bill, but there would be no kind of impact on other beverages that have aspartame and other types of very bad things in it. So my concern is by taxing one part of it and not the other, it will send a message that it's okay and probably healthier to choose a diet soda or to choose something that is probably just as bad. So I wanted to ask, I guess, the physicians or even Diliana as the director, or Ginny, you know, did the task force actually talk about what unintended consequences could occur by doing a tax just on the sweetened beverage?
Thank you, Senator. Yes, early on, actually, that was one of the first things I brought up because there was some recent literature about the negative impacts of diet drinks as well. And we don't have good data, really good, solid scientific data. And so the recommendations of this task force was coming from evidence-based information from the Institute of Medicine. And at this time, we don't have enough science to know whether or not diet drinks are harmful or not. Whether they contribute to the obesity issue. So we going with the facts that we have, and we do know that if we put a disincentive on consumption of these sugary beverages, that it will significantly reduce the calorie consumption for our population, and it will help towards the fight against obesity.
I think there's pretty good evidence about aspartame, though, being a neurotoxin and actually having as poor a health effect. So again, I just hope that in the conversation, if the legislature actually moves forward with something like this, that we wouldn't only tax one thing and not another.
Well, we're focused on obesity right now, so it had to do with the
and that's part
calories.
of the problem. What we've done is siloed the health concerns when we all know that everything is connected. So I think that's something as a legislature we have to think about if it has not been discussed to any extent within the health community. The other thing is, I think for the paperwork part of it, for Victor and was there a restaurant person? I needed to understand what you actually mean by that. What kind of paperwork are you thinking this bill would have?
Give an example. One of the first examples would be if I sell a coffee, okay? My coffee has no tax on it. But if you as a customer in a coffee shop put sugar inside, now how do we ascertain as to what's a taxable drink and what's not a taxable drink? In many of my restaurants, we sell diet soda, we sell water, things like that, and we give the customer a cup. It's a customer choice to draw from the fountain which drink they would like to do. So how do I say what is a surcharged drink and what is not a surcharged drink? That's another thing. And then the record keeping about reporting to the health department or the tax department. I mean, between the two bills, I get confused because they all have a multitude of record keeping and reporting that's required of it. And for me, it might be easier But for an average retailer that's opening, have a shop out there and things like that, that becomes a very tasking job for them to do. So these are like, some common sense questions that I have. And then when you talk about sugar sweetened beverages, there's a lot of things that have some amount of sugar inside. You get, the breath is wide open. And so, a shop that's selling bubble drink, depending upon, how much syrup they go in and things like that, how they define how much is taxable, what is not taxable. These are the nuances that, as a business person looking at it, I say, wow, this is, might be difficult for me to try and figure out.
I have little doubt you can overcome these challenges, Victor.
I'm not smart enough. I'm not smart enough to go to med school.
You had a follow-up question for Victor?
No, for the director.
Oh, director.
Only the smart guys go to med school.
Good afternoon, Director.
Good afternoon.
I would be remiss if we didn't have our annual discussion. And, first of all, let me say, by the way, I have tried for the last several years to get the chairman off aspartame. He ingests it every day, and I'm worried about his mental health, really. So I keep working on that. Director, my question always is, what is the role of the parents and the responsibility for parents in the home here? I mean, we keep, involving government and having government tell people what to do, what they must do, what they can eat, what they can't eat, how they have to live. And yet, that's a small part of life. And if we can't, through all of the educational programs we've had and all the money we've spent to educate people, if still we can't admit or recognize that this is a parent's responsibility. If I have an obese kid who sits on the sofa and goes like this all day, that's my responsibility. That's not yours. And by taxing all the rest of us, including many adults who like sugary beverages, you're penalizing us for something that parents are not doing. How do you respond to that?
That's a very good question. It's a very complex answer. As you heard from many of the physicians that came up here, parents are going to their physicians and saying, what can I do? And part of it is we lived in a world, if it was just between parent and child, it would probably be very contained. But unfortunately, we live in a world where there's a lot of marketing out there. And that's what's at issue, is that there are pitches being made about buy this, buy that. And what we are trying to direct here is putting incentives on healthy eating and putting disincentives on poor eating habits. And yes, parents have a lot to do with it, but so does the marketing industry. I mean, we've seen the same thing with tobacco. There's a lot of incentives out there. Come in, we'll give you any size drink for $1. That's very tempting. And there's been the talk about it being regressive. Yes, it is regressive. But who is at greatest risk are the poor, because they buy these things because they're cheap. And again, if we're looking at price sensitivity, that drives decision making, what you purchase. And the other thing related to cost. Why is it my concern? My concern is because this is costing me my healthcare dollars. It's costing your healthcare dollars. Our insurance rates continue to rise up. And part of that is because we're treating such hard diseases as diabetes. So we're either going to have to do something on the front end or we're going to pay for it on the back end. And we're currently paying for this disease at this point in time.
Well, I agree with that, and I understand that. What I'm suggesting, though, is do you have a direct correlation between sugary beverages and obesity?
Yes. The science shows that.
The science shows that. We have other science, though, that disagrees with that.
No, the science is clear that there is the consumption of sugar and obesity. And the primary source of sugar in any individual's diet today, the largest portion of it is through sugar-sweetened beverages.
I guess I didn't make myself clear. So if you ban sugar altogether, would you have obese children or not?
If you ban sugar? We would probably see a decline in obesity. I would agree with that. So if you want to ban sugar...
I wasn't saying that would happen. I was asking you. because I think all these other factors are as important or certainly more important. And the other thing is, I agree with you absolutely that this is a regressive, punishing tax on the poor and low income because they buy probably the most of these kinds of drinks. By having this tax, you're not going to stop them from buying it. What you're going to do is charge them more. When I go to the store and I buy a pack of soda or whatever, I'm already paying a beverage tax from your department. I'm already paying a general excise tax, and it's significant. Now you're adding another tax, and what I'm saying is you're not going to get people to, not to use that or to disallow it. You're just going to force them to pay more.
Well, we have shown, studies have shown, if you look at tobacco, it influences what we purchase. And the higher prices on something, we won't purchase it.
Well, I know. You started out saying you were concerned about people that smoked, but really what you want to do is keep them alive enough so that they can continue to pay to support government programs, right?
No.
You don't, no?
We want healthy people.
Well, then ban cigarettes. Why don't you ban cigarettes?
That's not the substance of this bill.
Okay. Let me get back to the special fund that you want to create. Another special fund in this state. There was mention made of the tobacco special fund. And when the tobacco special fund came out, everybody was cheering and they were happy. And what happened 2 years later? Every other group came in and started siphoning money off that special fund that had nothing to do with tobacco cessation or education. You don't think that that would happen with this special fund?
I would hope not, but I'm a realist.
Hope floats. Yeah, I understand.
And it's all dependent on what's happening within the economy. But currently, right now, last year we came to the legislature and we asked for a general fund appropriation to address childhood obesity. We were very modest in our request. We asked for $500,000 in general funds. You know what we got? Was go use your tobacco settlement money, $250,000. And I think we need to make a firm commitment in this state that we're going to look at addressing childhood obesity and put some resources to that.
I think a lot of people get obese because of the taxes and regulations they have to undergo with the state already. And all we're doing is asking for more taxes. I just came from another hearing in there. They want to put another tax on cell phones to take care of trauma care. There's no nexus there, but what we do is when we see that it's an easy target, like people that buy or use sugary beverages, let's go after them. Well, we'll continue to disagree, but thank you very much.
And I hope your cat is doing well.
It is, thank you. That's our area of agreement.
Yes.
Thank you, Director. Thank you, Mr. Chair.
Stay there for a second, Director. Just let me ask you a couple more pertinent questions. So could you describe the nexus between the tax and the programs that you have in mind?
Okay. Again, all the programs that we have are considering for funding would have a direct relationship to changing behavior. Again, starting with infancy, looking at promoting breastfeeding, looking at the preschools and working with the preschool settings on wellness guidelines, both nutrition and physical activity, working at the school level, working with the Department of Education. We've had some pilot projects that have worked very well with looking at community gardens and educating children about use of vegetables and fruits in their diet, physical activity and fitness at the school level, working with the communities so that we can have walkable communities, bikeable communities, working with the businesses related to worksite wellness programs. So it all would be a nexus towards promoting healthy behaviors, good eating, and physical activity.
Do we also, stay there for a sec, do I still have the Director of Human Services or someone from the department?
Oh, she's on the floor.
Oh, sorry, Director, if I could just come up and join the Health Director. Thank you, Directors. Good to see you both together. How many people do we have on Medicaid statewide, Director? More or less?
Approximately 290,000.
Okay, and we pay for their services when it relates to diabetes. Is that correct?
Correct. We provide universal.
What's our general budget for the individuals that are on Quest or Medicaid statewide per year?
Our annual budget, I think, currently is approximately $1.4 billion for Medicaid.
So $1.4 billion for those who didn't hear. Do you think that there would be a decrease in cost in health care if we were able to decrease consumption of sugar-sweetened beverages?
Well, I think any efforts we make to improve health care among our children will decrease Medicaid costs in the long run. Listening to the testimony today, there appears to be a one-to-one correlation between sugary drinks and childhood obesity. So I would concur that it should have an impact. I can't quantify that, but it should have an impact.
Okay, thank you. Chair has another question here.
For Director Fuddy, can you help me understand how you ended up with 37 million when asked how much revenue will be generated?
If I can ask Lola, my staff person, to come up and look at that. Again, it's based on 1 cent per ounce, and it would be passed on to. It's at the distributor level, and it would be passed on to the consumer. I'm sorry.
That is through the Yale Red Center. There is a calculator where the health economists have looked at the impact of 1 cent per ounce, and what they do know in terms of how many beverages are sold in the state, and so they do state by state as well as national calculations, and you can put it in by fiscal year and find out the amount of revenue that would be generated.
So when you say beverages sold, are you speaking of canned beverages or canistered beverages or measurable beverages as opposed to beverages that might be at a a bag of coffee that you then grind into a beverage?
In this situation, in this SSB fee bill, SB 1085, it is about beverages that have sugar already added. And so it would be at the distributor level where the fee is imposed.
Can I follow up?
So if it's a distributor level, then I presume then it comes in is it reasonable to presume it comes in a Matson container in a case that's unloaded or loaded and transported to a marketing area? Is that typically what you're speaking about?
Yes, at the distributor level. So most of the time it would be by gallonage. So it would look at 1 cent per ounce. So that would be about $1.28 per gallon.
Are these beverages? Measurable beverages include beverages that are manufactured and canned in Hawaii as well?
If it is manufactured and canned in Hawaii for Hawaii consumption, yes.
Okay. Is that 37 million per year?
Yes.
It would be a gradual build-up. I mean, we wouldn't yield 37 in the first year, but once we're fully implemented, it would be 37 million. And I forgot to mention that one of the other investments that we'd like to make is in oral health. I mean, Hawaii has one of the poorest oral health in the nation, and we really need to look at putting some of these resources towards improving oral health for our children and our adults as well.
Okay. What was your name again?
I'm Lola Irvin.
Lola.
Yes.
Now, is it reasonable, according to your data, that from on the 365th day from when the program begins, it's $37 million per year, according to your data?
No.
Okay, can you help explain that then?
We would have to look at making administrative roles, of course.
Okay.
And then in terms of the infrastructure, we would be building it. And then in terms of when we would start to implement, I don't expect that we would start on July 1 of a year. So we may be starting perhaps mid-fiscal year. So the amount that we would collect would depend on when we are ready to start.
Okay. I'll ask the question one more time. Is it reasonable that once you begin, on the 365th day that you begin, from when you began, the state would be collecting $37 million, according to the data you
Yes.
Okay. And you believe it'll take several, you said mid-fiscal year. Does that mean that you expect that well, let me ask it in a different way. How long will it take for you to get to the point where the state would be collecting $37 million per year?
We were thinking about 1.5 to 2 years.
1.5 to 2 years.
Yes.
will this program support any personnel, support staff, B costs, C costs, all included, paid for by this new income stream, as opposed to asking the legislature to provide general funds for more personnel, benefits, et cetera, et cetera?
Yes, the bill is written so that those costs for infrastructure and the program, including the personnel, will come out of the fees.
Okay. Would they be considered civil servants or at-will employees? Would they be state employees? What's the mind's eye of the Department of Health with regard to this program?
The practice is to ask for civil service positions.
Okay. Then that would, is it then the Department of Health's intention that the 35% benefit costs for the copay and all of the retirement costs would be borne by this program, or do you expect that the legislature would provide additional funds?
It would come out of the special fund.
I see.
Any position that's not in the general fund budget, if it's special funded, we have to pay for the benefits out of the special fund.
I understand that, but I want it to be clear that it's not the intention of Department of Health to supplement this program with an ask of more personnel and benefit costs.
It would come out of the fees that are being charged.
How then would you deal with collective bargaining issues?
Let
me put it to you this way. Any collective bargaining issue then would be paid for by this program?
Yes,
okay.
yes.
Now, okay. Thank you very much. Now I'd like to ask the Director some questions. Yeah, Director, you provided some data.
Yes.
This is rough data? Is it public data? Is it data driven by...
This is data that has been driven by studies, information that comes out of Center for Disease Control. So it's public information.
Okay. So then let me ask you the questions. And I'll just pick a few issues that have... I'm not sure if we need to get more detail from you, but it clearly... the data you provided asks certain questions for more information. For example, you have a line item that says state and county policy implementation for daily physical activity through walking and biking. 250,000 the second year, 2 million the third year, and 2 million the fourth year. Can you explain what's in what thought processes led the department to earmark that kind of funding, and what you expect that?
Let me give you an example of what we're currently doing, and I'll ask Lo to come up as well. But currently we're working with the city and county, and a lot of that has to do with, in the communities that we live, how can we help them to plan better with communities? We worked with the Parks and Recreation, for example, in Honolulu, and they had a soda-free summer. So they had the students that were part of their summer free take a pledge. So we're helping to educate and helping them to implement policies that make sense so that we can support our communities, so that our neighborhoods are more conducive to activities, and that we can get the exercise. Because it's all about consumption, and it's all about burning energy and calories. So we have to look at how can we get our communities to be more livable, workable, and bikeable, walkable, and it's working with the city and county on those policies and procedures. So maybe, Lily, you want to comment a little more?
Most of these monies will be put out by 103D RFPs, so we'll put them out as opportunities for the community organizations to apply for. So an example that we have done in the past is we wanted to see what community organizations would do to increase physical activity opportunities using the Complete Streets and Safe Routes to School strategy. For example, we had Kukuakalihi Valley that work with at-risk youth. And they take bicycles, refurbish them, teach the youth how to use them, but also then they give the youth the opportunity for ownership if they complete the program. They also mapped the area where they live to show how they could safely use the bicycles. It also helps us understand in terms of what else is needed in terms of infrastructure where they live to support being physically active. The other thing that KKV did was then also use some of these refurbished bicycles for their Worksite Wellness program. So rather than hopping in a car, they can also use the bicycles to get from place to place. So these are the kinds of activities that we have funded in the past. We do not have that kind of money right now, but this fund would allow us to provide a playing field for a lot of organizations to be able to have this money so that they can then provide physical activity opportunities.
We want it to be community sensitive, so we would put it out the money to the community, and that the community can then drive the activities that they think is appropriate for their lifestyle as well, that it's more culturally appropriate.
Okay, one last question. How do you intend to have measurable outcomes? Your home visitation program is 3 million, 7 million, 7.5 million, 8 million. How do you have measurable outcomes to determine whether the money is appropriately earmarked and spent?
For each of the programs that we have, as part of the scope of work with the contracts, we would have specific deliverables, and we would look at health outcomes. So, for example, looking at home visitation, part of it would be looking at the healthy birth of a child. We'd be looking at whether they completed immunization. We'd be tracking BMI, so we'd be looking at the weight of the child. So we'd be looking at specific health indicators. We'd also be looking at school performance in many ways, because we think this will help improve school performance. So this will be part of the data system. So part of the money will be used so that we can be able to track these specific indicators.
Thank you very much.
Thank you.
Okay, members, we're going to move on to Senate Bill 875, Workers' Comp, and we'll submit some additional questions to the department before we get to voting. Relating to Workers' Comp, first let's take a 2-minute recess and let people clear out.